Okay, well, osteopathic medicine is not well understood, so I'd like to talk about it a little bit. Our training is in many ways exactly the same as an MD. We go to medical school for 4 years. We take all the same subjects. In addition to that, we have nearly 300 hours of osteopathic principles and practices. The last 3 years and then we have at least 3 years of residency, hospital-based residency in our specialty of choice. We're licensed in all 52 states. The DO license is exactly equivalent to an MD license. We can prescribe medications, we can perform surgeries. I could have been an obstetrician or a brain surgeon, but I chose to do traditional osteopathic manipulative medicine. The difference is in our philosophy. We look at the whole person. We look at the unity of the body, the mind, and the spirit. And we recognize that a person has their own inherent forces of health. And we see our job as supporting that, allowing that to function optimally, rather than imposing some idea of how you're supposed to be or giving you a prescription for a substance that will change a symptom. We look at the causes and we look at how your whole body is trying to function, and we support that. Osteopathy was started by Andrew Taylor Still, who was an MD in the late 1800s, and he became discouraged with the medicine of his time. They were using arsenic and mercury. Of course, we use toxic substances today, but we're a little more scientific. There was an epidemic of meningitis, and unfortunately, the best doctors of his time were unable to save his family. He became depressed and went off into the woods to meditate, and he began to dissect the animals that he liked to hunt. And he noticed that wherever there was disease, he noticed an irregularity in the circulation or the nerve flow to the diseased area. So he conjectured that structure is affecting function, making the animal vulnerable to disease. He began to dissect many human cadavers and found the same thing, that structure affected function, that impairment to circulation or nerve function predisposed somebody to disease. So he began to do manipulation of his patients, and of course he had great success. And osteopathy is the result of that. He said he discovered it. He didn't invent it. It's nature. So instead of trying to find a substance that will change a symptom, we look for the cause of disease and try to allow normal structure to facilitate normal function. We're always seeking health. Dr. Still said, anyone can find disease. Our job is to find the health in a patient, and we support that. And that's applicable to all medical conditions. Thank you.